Felbatol is a medication used to treat severe seizures. It is specifically for those who cannot take other medications or when other medications have not been able to control their seizures. Felbatol is known as an anticonvulsant or anti-epileptic drug. It is important to follow the dosage prescribed by your doctor and to take it at the same time every day. The optimal timing for taking this medication can vary depending on your individual needs, so it's best to consult with your healthcare provider. It's important to understand the benefits and risks of taking Felbatol, so be sure to discuss any concerns with your doctor. Before taking Felbatol, make sure to read and sign the informed consent form provided by your doctor. Also, read the medication guide provided by your pharmacist before starting the medication and each time you get a refill. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually 3 to 4 times a day. If you experience stomach upset, take with food or milk. If you are using the liquid form, shake the bottle well before each dose and carefully measure the dose using a special measuring device/spoon. The dosage is based on your medical condition and response to treatment. For children, the dosage is also based on weight. Your doctor may direct you to start at a low dose and gradually increase to reduce the risk of side effects. Take this medication regularly at the same times each day to get the most benefit from it. Do not stop taking Felbatol without consulting your doctor, as seizures may become worse if the drug is suddenly stopped. If you are already taking other anti-seizure medications, follow your doctor's directions for adjusting the dose when starting Felbatol. Remember to tell your doctor if your seizures get worse. Some common side effects of Felbatol include drowsiness, dizziness, nausea, vomiting, diarrhea, constipation, trouble sleeping, loss of coordination, headache, blurred/double vision, hiccups, or loss of appetite. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. However, it's essential to notify your doctor immediately if you experience any serious side effects, such as fainting. Additionally, a small number of people who take anticonvulsants may experience depression, suicidal thoughts/attempts, or other mental/mood problems. It's important to seek help if you or your family/caregiver notice any sudden changes in mood, thoughts, or behavior. While a serious allergic reaction to this drug is rare, it's crucial to seek medical help immediately if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed. If you are in the US, you can call your doctor for medical advice about side effects or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects or report side effects to Health Canada at 1-866-234-2345. Severe blood and bone marrow problems, as well as liver problems, have been reported with the use of Felbamate. It should only be used by individuals with severe epilepsy that cannot be controlled with other medications, and it should not be used by those with liver problems. Before starting Felbamate, it is important to discuss the risks and benefits with your doctor. If you experience signs of infection, anemia, easy bruising or bleeding, or signs of liver problems, it's important to notify your doctor immediately. People with liver problems while taking this medication should not restart it. Your doctor will monitor certain blood tests and may refer you to a specialist before and during the use of Felbamate. These problems may also occur after you stop taking the medication, so it's important to keep all medical and lab appointments. The daily dosage and optimal timing for taking Felbamate should be determined by your doctor based on your specific condition. Before taking Felbamate, it's important to let your doctor know if you have any allergies to this medication or similar drugs. This medication may contain inactive ingredients that could cause allergic reactions, so it's important to talk to your pharmacist about any concerns. It's also important to discuss your medical history with your doctor before using Felbamate, especially if you have any blood or bone marrow disorders, liver or kidney disease, or mental/mood disorders. Felbamate may cause dizziness, drowsiness, or blurred vision, and can also lead to double vision. It's important to avoid alcohol or marijuana while taking this medication, as they can increase these side effects. It's also important to avoid activities that require alertness or clear vision until you know how this medication affects you. Limiting alcoholic beverages is recommended, and if you are using marijuana, it's important to discuss this with your doctor. Before having surgery, it's important to inform your doctor or dentist about all the medications and products you are using. For older adults, it's important to be aware that they may be more sensitive to the side effects of Felbamate, which could increase the risk of falling. If you are pregnant, it's important to discuss the risks and benefits of using Felbamate with your doctor. Similarly, if you are breastfeeding, it's important to consult your doctor before using this medication, as it passes into breast milk and could pose a risk to the infant. It's important to be aware of potential drug interactions when taking Felbatol. This medication may interact with other drugs, such as clopidogrel and orlistat. It's important to keep a list of all the medications you use and share it with your doctor and pharmacist. Additionally, Felbatol may decrease the effectiveness of hormonal birth control, which could lead to pregnancy. If you are taking this medication, it's important to discuss with your doctor or pharmacist whether you should use reliable backup birth control methods. Furthermore, if you are taking other products that cause drowsiness, such as alcohol, marijuana, antihistamines, drugs for sleep or anxiety, muscle relaxants, or opioid pain relievers, it's important to inform your doctor or pharmacist. Always check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. It's best to talk to your pharmacist about using those products safely. If someone has taken too much Felbatol and is experiencing severe symptoms like losing consciousness or difficulty breathing, it is important to seek immediate medical help. In the U.S., you can call the local poison control center at 1-800-222-1222, while in Canada, residents can call a provincial poison control center. It is important not to share Felbatol with others. Before, during, and after taking Felbatol, it is crucial to undergo lab and/or medical tests, such as complete blood count and kidney/liver tests. This is to ensure the medication is working effectively and not causing any harm to your body. Be sure to follow your doctor's recommendations for these tests. If you forget to take a dose of Felbatol, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Do not take a double dose to make up for the missed one. It's important to store Felbatol at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and away from children and pets. When you no longer need the medication or it has expired, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do this. And remember, never flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.